Welcome back, everybody. Now, globally, 50% of lifetime mental health disorders begin by the age of 14, highlighting lifelong impact that the failure of mental health care in childhood and adolescence can have on an individual realizing their full potential and having a quality of life in adulthood. For Human Rights Day this year, the South African Society of Psychiatrists has called for the urgent implementation of the National Mental Health Policy Framework and Strategic Plan 2023 to 2030 to protect children's right to mental health care. SASOP warns that chronic underfunding and neglect of mental health care represents a failure to protect the constitutional rights, the dignity and the well-being of children and adolescents. The member of the South African Society of Psychiatrists, Dr. Mahlatse Thosago, joins us now for more. Dr. Thosago, a very good evening to you. Thanks for joining us. Welcome.
Hi, Simpiwe. Thank you for having me.
First, let's unpack the systemic failures, the human rights implications, the solutions around child and adolescent mental health care in South Africa. Firstly, by framing the crisis in terms of mental health as a human right. Now, SASOP describes that the lack of access to mental health care for children as a basic human rights crisis. Now, from a clinical and ethical standpoint, Dr. Thosago, why is this framing justified?
So it is justified in that, children do have a right to not only physical health, but mental health too, and a right to not only physical safety, but also emotional safety. Yet physical health continues to be prioritized over mental health, despite the scale of the need and the long-term service and economic costs of not securing the mental health of a future generation. The children's lack of access to mental health care represents a gross violation of their human rights, as you said, Simpiwe, but this also robs them of their quality of life now and into adulthood, and thus increasing the risk of tragic loss of lives.
And when only 1 in 10 children can access care, what does that mean for the remaining 90% in real-life developmental terms?
Exactly. So that obviously means that a majority of children are not exposed, or at least do not have access to mental health care because of the underfunding and also because of the lack of resources. I mean, there are only 40 child and adolescent psychiatrists, both in private and in government sectors. And besides that, also in terms of hospital beds for children, there is less than 13% of hospital beds for adolescents and close to zero for children less than 13 years. So it does cause a huge concern for access.
And since that it is a matter of huge concern, are we sort of underestimating the long-term national consequences of neglecting mental health at such a critical age?
Yes, definitely. As I said, as you said already, the peak age is 14.
Yeah.
Preventative approach is actually the ideal way. Instead of trying to cure the children, I think if we were to focus more on screening techniques, preventative approach, which is vital to addressing South Africa's overall mental health crisis. And it is also an investment in intergenerational health that will contribute to breaking the cycle of violence, poverty, food insecurity, social exclusion, and discrimination, which are all contributing to socio-economic determinants of mental health. So what we can do, because all children have the right to education up to at least the 9th grade or age 15, what we can do is do an integrative approach where we instill knowledge into our educational system, but also keeping in mind not to overburden them as well.
Now, can you walk us through how untreated childhood mental health conditions evolve into adult psychiatric or even social challenges?
Yes. So the most commonest childhood mental conditions include neurodevelopmental disorders such as ADHD, autism spectrum disorders, which when the child goes untreated can develop into problems such as substance use disorders or substance abuse, and even can develop to bipolar disorders. They also do have anxiety or fear-related disorders, obsessive-compulsive or related disorders, problems with feeding and eating, stress and trauma-related disorders, and depressive disorders, which, if treated at a younger age, will not have as a huge impact as we do see currently with adults presenting with these preventable conditions.
Now, is the biggest issue infrastructure or funding, or could it be workforce shortages or even policy failure, or a combination of all these factors? And how does this access gap differ between the urban and the rural communities?
It is actually a combination of all of the above. And yes, the rural sector is much more affected than the urban sector. But even then, it's still not enough, even in the urban setting. So when it comes to underfunding, as already highlighted, only 1% of the health budget is to mental health care. And then also when it comes to access to the mental health care, majority of the specialists are in urbanized areas instead of the rural areas. So a lot of people in the rural areas are pretty much affected.
Well, I did mention in the intro that SASOP has called on the government to adopt the National Mental Health Policy Framework and Strategic Plan 2023 to 2030. Where specifically is the implementation failing, or rather falling short? Are there any areas where the government is getting it right, even incrementally?
So unfortunately, currently we haven't seen it being implemented. They are falling short. We are in 2026, and this was from 2023 up to 2030. So we're left with only 4 years. So this National Mental Health Policy Framework and Strategic Planning provides a roadmap for integrated community-based care, but it is failing in its implementation, which still remains unequal across provinces.
All right, Dr. Thosago, great chatting to you. Thank you so much for joining us.
Thank you so much. Thank you, Simpiwe.
All right, that was a member of the South African Society of Psychiatrists, SASOP, Dr. Mahlatse Thosago, saying that early intervention is critical, especially as half of all lifetime mental health conditions begin by the age of 14, shaping not only individual futures, but the trajectory of society as a whole.